A final domain of ethical challenge is the diffusion of responsibility that occurs with robotic and remote care. There's a much more extensive array of stakeholders and contributors to the delivery of care in each case than in a simple personal physician-patient encounter. You have the remote interventionalist, but you also have local physicians and nurses. You also have the hardware manufacturer of the device and the software coders of any artificial intelligence that might be supervised. And you also have the AI system itself that, for which AI governing ethics need to be devised. So it's important to have an active, continuous partnership among all of these groups. There is a standard ethical guide in analyzing a moral situation of Cui Bono Who benefits, and an additional aspect here is Cui Causa Legalis, who has a legal case if something goes wrong. And all of these steps in the chain of responsibility are subject to malpractice concerns, and appropriately they should be, and that helps to drive collaborative partnership among these groups. In addition to all of the concerns we've covered, it's important to recognize that there are countervailing ethical considerations of the benefits from these programs. First are the future patients who will benefit, both future patients of the physicians themselves once the therapy becomes optimized and well established, and future generations of patients. We always have to give primacy to the patient who's in front of us, but we do owe some allegiance to forging better care for everyone going forward. And then lastly, for this intervention, there are important concerns in protecting the interventionalist themselves by being able to be outside of the room when directing a robot. Interventionalists are able to reduce their exposure to radiation, and we know that they are increased risk of, very small, but increased risk of cancer from that exposure. Every time they're in the room, there's a slight mortality hit that they take. There's also the risk of back pain and other problems from wearing the lead in the room that does not accumulate if you're outside the room. And protecting the interventionalists is certainly also an important moral good.